Hello, everyone. Thank you for joining us today for USDTL ToxTime. I'm your host, Grace Della Pena. Today's presenter is Andre Sukta, Research and Development Project Manager with USDTL. He'll be discussing xylazine background, prevalence, and co-exposure in hair in high-risk population. We have a lot of attendees today, so we will try to answer the questions that are most relevant to the presenter's expertise during our limited Q&A time. For those unable to stay for the full presentation, this event is being recorded and we will share with everyone that registered. Some part of this presentation will be interactive with poll questions that will appear on your screen. So without further ado, I'd like to turn this over to Andre Sukta.
Hello, thank you for attending this month's ToxTime. My name is Andre Sukta. I'm the R&D Projects Manager, and I'm here today to talk to you about xylazine, some background, some prevalence, and co-exposure in hair in a high-risk population. So here at USDTL, we are on a mission to make a difference. We do that by using our vision of protecting and enriching lives and our mission of using the best science available to provide cutting-edge tools for the analysis and evaluation of exposure to alcohol, substances of abuse, and toxins. Here are my disclosures and disclaimers. I am a paid employee of United States Drug Testing Laboratories, a commercial provider of forensic toxicology testing services. Any mention of brand names are for reference only and are not an endorsement of any brand or product. All information is provided is for educational purposes, and any opinion that I provide is that of myself and is not a representation of USDTL or any other organization that I am affiliated with. So first off, I kind of want to do a jump back in time. So we're going to go in the Wayback Machine with Mr. Peabody and Sherman here and go back to 2002. Now, for some people, that is not a long time ago. But the reason we're going to jump back to 2002 because that's the start of my career in toxicology. So I graduated undergraduate with my Bachelor's of Science in Chemistry from Benedictine University. And my first job was to do equine performance testing. And I did that for 9 years. Started with the state of Illinois doing the various racehorses. And then it got outsourced to the University of Illinois at Chicago, where I continued to do the same job for the rest of that time. Equine performance testing is a really interesting background of testing in toxicology because while we say that we're really looking about performance and most people will think about enhancing performances, that's not entirely all the things that we had to look for. Due to the nature of the racetracks, and the shared stall or shared barns, more so not so much stalls, but shared barn space that's available, it actually is pretty easy to add something to cause a horse to not perform well. So we were really tasked with testing for a variety of different things. Our main reporting analytes that we had that we would see in a general year, phenylbutazone was far and away number one. That's the one that was the most abused. And when we say abused, not necessarily that they were using it poorly, but we had a 24-hour ban for any drugs that were allowed to be given, even the ones that were legal. And so while phenylbutazone is normally allowed, not allowed within 24 hours of the race. And so there was studies that were done, and then we had a cutoff that allowed us to detect whether the horse was given that compound prior to 24 hours, or less than 24 hours, excuse me. So that's the one that was most commonly abused. Ketamine was abused a lot, usually in conjunction with other things. Phenylbutazone as an NSAID was commonly found with ketamine, which is another NSAID. Benzylaginine, which is a metabolite of cocaine, lidocaine, which is a topical anesthetic, acetaminophen, Tylenol, levamisole, which is a cattle dewormer, and I'll get more into that in a minute, and then xylazine. I want to note that I put an asterisk next to phenylbutazone and lidocaine for a reason. We're going to kind of see that come back up later in this presentation. First off, I want to talk about levamisole and why I think levamisole is interesting at any rate. So back in the 2000s, when I was here at the Equine laboratory, there was a strain of cocaine, I say strain, but a batch of cocaine that had come through that had levamisole as a cutting agent in it. Levamisole is a cattle dewormer, horse. It's used in any of our large animals, cattle, horses, but it's used to deworm them. And it started being cut into our cocaine supply, and that supply was coming through the Chicagoland area. So that was sort of my first hands-on experience of seeing our human supply of drugs be cut with something that I'm testing for in an animal performance testing laboratory. And this is a really nice slide that the DEA put out back from 05 to 09. The white bars are the total number of cocaine samples that were seized. The red is the percentage that had the levamisole in it. So you can see as we went from 2005 to 2009, how by the time we got to 2009, 73% of the cocaine supply that they were collecting ended up having levamisole as a cutting agent into it. So we thought that was a pretty interesting. So this is not our first go around using veterinary drugs to enhance the performance of our drug supply. But back to xylazine, 2006 to 2008. In 2008, it was reported out of the Philadelphia Medical Examiner's Office that they found the concurrent detection of heroin, fentanyl, and xylazine in 7 drug-related deaths. As far as I can tell, this is the earliest report of xylazine appearing in any of our drug supplies, and Philadelphia is where they first reported it. Now, they found it because they ended up looking for it, but that's not to say that it hasn't been around. We just may not have been looking for it, and that's a challenge in our industry in general. Because I've noted that this is the start of my career, I also went back to school and got my master's in science and forensic science from the University of Illinois Chicago in 2009. In 2012, a report is published out of Puerto Rico, and it's in the Journal of Urban Health. And people that were abusing xylazine were in this as part of the survey. And so the number of years on average that a person was abusing xylazine was 3.4. 80% of the respondents had said that they have used xylazine, that injection was most common, and most commonly was mixed with a speedball or heroin and cocaine. This was also the first time where people indicated that they may have been using xylazine all by itself. So when we talk about how the prevalence in Puerto Rico is where some of this first was seen, this is that initial paper. Now, this is a survey, and the thing that we know about surveys is that people that are using or abusing drugs do not always know what they're getting. And you can look at any of the data that is now being published as far as the accuracy of compounds that are being found on the street. And so even though they said that they were using xylazine, purely xylazine, we don't actually know that. We don't have any actual data or toxicology data in a biological specimen to back that up. We just have their survey results. So as we're talking significantly about xylazine, so what is it? So xylazine is commonly known as Rompum, Anisette, and Cetazine, and those are the brands that make xylazine for veterinary use. So I want to stress that that is not the street name, that is the manufacturer's name. It's a drug that is only for veterinary use. It causes sedation, anesthesia, muscle relaxing, and in felines, it's an emetic. So it's used to help the cat regurgitate whatever it may have accidentally swallowed. And it's commonly mixed with ketamine, another common NSAID. So it was developed in 1962. It was designed as a structural analog of clonidine. It's an alpha-2 adrenergic receptor agonist. It is not approved by the FDA. They did, when it was first developed, it was designed to go into human, for human use. It went as far as it got to human trials. During the human trials, due to the significant reduction in blood pressure and heart rate, they pulled it from the market. and they said that this cannot be allowed in the human population. So this is an interesting one because this drug actually went to human trials and then got pulled and said it cannot go, not be allowed for human use. Hypotension and bradycardia are some of the other side effects of xylazine. So it's a non-opioid sedative or tranquilizer. Street names are commonly called as trank, trank dope, or sleep cut. And it's most commonly found as an adulterant, and it's typically not sought out by itself. Like I said, in that Puerto Rico survey, it indicated that they might have been trying to use xylazine by itself, but that's the only time thus far that we have seen it. And so as we get more and more data, we might find that to be incorrect or correct. And so we'll keep you updated as we know more about this particular drug. It is reported by users that xylazine enhances, lengthens, and or heightens the feeling of the other mixture that it's in. The problem that we're seeing, the problem that is happening with xylazine is that while fentanyl is the most obvious adulterant that it's going to be used for, it's actually being used for other things. So you're finding xylazine in fentanyl, in cocaine, in metronidazine, methamphetamine, morphine, and quinine. So it's being used as an adulterant in a lot of other compounds. And so this is causing some challenges because it's this weird sedative effect when you're using a cocaine or a stimulant. You're kind of getting this mixture of two things. And so it's making it harder for a lot of our first responders to determine what is actually happening. And so anybody then that's pulled over in like a DUI scenario, so we're not even talking about a serious offense, but in a DUI where maybe they were weaving or falling asleep at the wheel or having some other issue, it's causing a lot of challenges in any kind of identification there, but it's still an impairing substance. So xylazine, because it's not an opioid, Narcan or naloxone is not effective on xylazine. So but it should be noted that I'm not a medical doctor, but I am a toxicologist, and it's still recommended that in an overdose scenario, the person be treated with Narcan. It's going to help eliminate the other opioid effects, and they will still need to have advanced medical treatment. So it's still important that if anybody is in a overdose scenario, they get Narcan, and then they still have other life-saving measures that are needed. In 2018 through 2021, we see that these xylazine-involved deaths have risen significantly. In 2018, we had 102 deaths, and then in 2021, 3,468. And of those, 99 also involved fentanyl. And this came out of a paper out of JAMA recently. Also during this time, as I said, there's a little bit about my career in here. This is when I started my PhD, and I'm still working on it. And xylazine is actually my PhD topic. So this is all very well related together. In 2020 and 2021, we see the DEA forensic laboratories start identifying xylazine in different regions. And we can see that in general, we are seeing a huge increase in the number of identifications of xylazine from just that 1 year, anywhere from 7% to almost 200% in the South. Now here at USDTL, we do a variety of analytical testing. One of that is in our umbilical cord. So this is more of for our newborn side of the house. So with hospitals and things, we're looking at what xylazine ingestion would look like in young children. This came out in the Journal of Pediatrics. And so this was the first case reports of 3 young children that got into or were exposed to a drug supply that contained xylazine. So these are not newborns yet. These are slightly older than newborns, but they were somehow exposed to this. And that's of a concern for us because we want to make sure that on our newborn side, that these babies are getting the proper treatment so they can have the best health outcomes long term. So in 2023, we launched our umbilical cord testing. There was another laboratory that also launched umbilical cord testing that same year as us. And it's a simple tissue homogenized, followed by solid phase extraction technique, and then analysis on an LCMS. What's important here to look at is what the exposure is for this. We pulled 170 fentanyl presumptive positives. We tested them for fentanyl and for xylazine. Of that, 30 of them were also positive for xylazine, so or just under 20%. We found a median concentration of 2.27 nanograms per gram, and we had a range of 0.3 to 1,322 nanograms per gram. Interestingly, with this, we found a lot of the co-exposure as we expected. So remember, these are all fentanyl and xylazine positives, and they also have these other compounds. So we found a variety of different amphetamines, cocaines, methadone, opiates, and THC. Some of the other adulterants, a report was just published that were found in umbilical cord, caffeine, lidocaine, diphenhydramine, quetiapine, levamisole, acetaminophen, quinine, tramadol, etc. So these are some of the other adulterants that have been found in umbilical cord samples. In 2024, it's the National Forensic Laboratory Information System, or NIFLS drug, reported out how xylazine has been a significant increase over the years. We had 63 different accounts back in 2010, and in 2022, 11,701. You can also see in the top 10 cases of NIFLS what states are hitting primarily with xylazine. So, and the number of case reports that are corresponding to that. For us here at Xylazine in hair, we are finalizing our method now, and we should be able to launch this year. That is our hope, but we also did a retrospective review, and we had 438 fentanyl positives. So of those, we found 98 also contained xylazine, or about 22%. We had a median concentration of 14.6 picograms per milligram and a range of 1 to 2,734 picograms per milligram. The interesting piece with our xylazine in hair testing was that in about 20% of those cases, we only found fentanyl and xylazine. So whereas in the umbilical cord, we found typically a bunch of other things, in our hair, which is more of our adult child population, we're finding 20% have no other drugs in them. But we do see a lot of amphetamines, 50%, cocaines, methadone, some opiates, and THC. So as I mentioned at the beginning of the presentation, we talked about phenylbutazone being on the list of drugs that I reported out when I was working at the Equine Performance Laboratory. Our friends over at the Center for Forensic Scientific Research and Education, or CFSRE, they've put out a alert back in March of 23 talking about phenylbutazone as a adulterant in street drugs. And so they went and did a retrospective analysis, so going back to 2016, and how many cases they found that also included phenylbutazone in them. In addition, the most common additional findings, so these were phenylbutazone positives plus, so heroin and fentanyl were found in all of those cases, with caffeine and maybe some other adulterants, and of course xylazine. For those of you that aren't aware what phenylbutazone is a common NSAID, and so I've included this in our presentation just to kind of do a quick overview. And phenylbutazone, being a veterinary NSAID, is not commonly reviewed or looked for in the human population. And so it's important to know what the indications of toxicity are, so that if your medical examiner or coroner is looking and seeing these particular indications, that you might need to do an add-on test and have a look for phenylbutazone. Again, it's not the only commonly used veterinary NSAID. It just seems to be the one that is maybe next as far as being abused and put into the drug supply. The other drug that I mentioned earlier was lidocaine. So I said lidocaine. I'm also including some of the other quote unquote canes in this, such as benzocaine and procaine. And so our friends over at the CFSRE again, they put out in June of 23 a alert about different local anesthetics, so lidocaine and other canes that are being found. For us here, because since we're based out of Illinois, I like to at least pay attention to what's happening in my state. And so we're seeing a 15% positivity for lidocaine in our drug supply out of Illinois. And you can see that depending on where you're at, such as like Florida, you're seeing it at almost 60%. And then some of the states are more focused on like procaine, such as out in Vermont. You're seeing a lot of lidocaine and procaine. Now, they have a smaller, maybe total N, but it's still important to note what else is being seen in these street drugs. Now, that being said, when you take this and look at it a little bit more closely, so let's look at the cocaine. So cocaine without any of those local anesthetics. So the LA means local anesthetics. They're seeing 259 observations. Cocaine with lidocaine, 119. And then with the others, such as benzocaine, 19, 15, procaine, 11. So as you add these other canes in there, you're seeing them a lot less, but they're still in there. And lidocaine is the primary one. But it should be noted that you're still seeing most of these drugs, a significant portion of these drugs don't even have those local anesthetics in it. Fentanyl without lidocaine, without the local anesthetic, 166, fentanyl and lidocaine, 73. Heroin without, 56, with 33. Methamphetamine without, 391, and methamphetamine with lidocaine, 38. So it's just important that we're paying attention to what these other adulterants are and that they could be the next things on the rise, so that as we do our drug testing and optimize for new analytes, that we keep these in mind. And with that, I'd just like to close it out and say thank you. If you have any further questions, please feel free to contact me on my LinkedIn account, or you can email me directly at my email. And with that, we'll go ahead and take any questions.
Subscribe to our channel and visit our website for more information.